A hernia can be caused by lifting something too heavy or maybe something as simple as a sneeze. Either way, you may need surgery. And here to talk about some new approaches and what you need to know is Dr. William Braswell, a surgeon from Shelby Baptist Medical Center. Just to start with, very briefly, explain what is a hernia?
A hernia is specifically when an object goes from one space where it's supposed to be through an opening, either natural or unnatural, to a space where it's not supposed to be.
Okay, and it causes a bulge,
yes,
right? So what are the symptoms? What are the things that first show up?
Pain and or a bulge can be associated with nausea and or vomiting, but pain is the biggest symptom.
Okay, and what's the treatment? There are different ways.
There is,
right?
but once you have symptoms from a hernia, you need to have it repaired to avoid further complications such as what we call incarceration or even strangulation.
It's not going to go away on
Correct.
its own?
It is not.
Okay, so walk me through the ways that it will be treated.
It can be repaired open through an incision in the abdomen, or it can be done laparoendoscopically, either laparoscopic or robotic assisted.
Okay, and the different ways, how do you decide which way to use?
Based on the patient, but with the laparoendoscopic approach, particularly with the robot, it's through much smaller incisions, but with much greater precision and detail on the inside, and people get back to work and activities a lot faster.
Okay, and will it be completely healed
Absolutely.
after surgery?
Mm-hmm.
So that's something people really need to know. If you're feeling that pain, there's something to do for it. You don't have to just live with it.
Correct.
Okay. What happens if you ignore it?
They usually always get bigger, present with worse signs and symptoms, and the biggest fear is that the object, particularly intestine, will become strangulated and require an even bigger operation and may actually have to remove intestine.
Okay, so
the earlier the better.
The earlier the better. And again, describe very briefly the specific type of pain. Where are you going to feel it?
In an inguinal hernia in the groin, you'll feel pain basically at or between your legs. If it's in the abdominal wall, at the side of the hernia. If it's what we call like a hiatal hernia, you'll feel it in your chest. Sometimes hard to distinguish chest pain from hiatal hernia versus, cardiac pain, but it needs to be investigated.
Okay, don't ignore the pain.
Correct.
All right, Doc, thanks.